All right, there we are. I almost said good morning. It's far from morning, isn't it? Shows you how long my day has been. Hello, everyone. Thank you for joining us this evening. We are having mental health check-in. I should be first, huh, to receive some mental health assistance. Thank you all for those of you who are joining us on Facebook Live, as well as the ones joining on Zoom. So it's a pleasure to have you with us this evening. We're going to have some really good conversation. I always say that if you have any questions that you want to pose to our professional who's here this evening, you can type it in the chat or in the comment section. I am also monitoring you on Facebook as well. It's my pleasure to have Dr. Crystal Jackson here. She's a regular face around, our professional psychologist, licensed psychologist with her own practice. Always busy. You're also a mom, so you know how it goes when we have so much to do, right? Welcome, Dr. Jackson.
Yes, I absolutely know what it's like to be busy. Thank you so much for having me, Gail. It's always an honor to be on the panel.
For sure. We're going to talk about several things. So there's no specific topic for you that you're not limited to one thing to talk about. This is check-ins. That means if you have any question at all that our professional can address or we can talk about, if you are comfortable unmuting yourself, if you're on Zoom, it's easy for you to do. You can unmute yourself and ask the question yourself. Or if you prefer, you can just type it in and I can ask it for you. But otherwise, we're going to jump into a conversation. One thing is it Bullying Awareness Month? Is that how they express it? And we are going to focus a portion of our conversation on that. But we also have some questions that were emailed to me. So we're going to start off with those first. Is that okay, Dr. Jackson?
Yes, absolutely. Any questions are welcome. Any questions, whether it's about an individual's mental health, questions specific to that or a loved one's, if it's about resources that I can offer or direct someone to, I am here to do that as well. And yes, Gail, the month of October, along with it being an awareness for cancer during this month, it is also National Bullying Prevention Month as well. So two very important topics and national awareness efforts are put into the month of November.
For sure. Well, we're going to get started with one question that we have here. And it says, I have a nephew who recently has had several episodes describing as psychotic, which come on when he gets high on marijuana. He has been a heavy weed smoker for some time, was hospitalized in the spring briefly with a possible diagnosis of schizophrenia. Is there a possible link to precipitating factors using marijuana and psychosis? I understand that it is much more powerful than it was decades ago.
Yes, well, the quick answer to that is absolutely. There is a diagnosis that we use that is a substance and
Oh, you went, it's on mute right now, Dr. Jackson.
Okay. The quick answer to that is yes. There are many different drugs that can induce a psychotic episode. And so there is a diagnosis that we would use as psychologists from our diagnostic tool and measure that is a substance-induced psychosis. And so it sounds like from what the person who raised that question, it's the mom who raised the question, it sounds like that may have been what happened. Was it a mom or an aunt? Was it a nephew?
Or nephew, so the
nephew, yes.
Or
so it sounds like that is what has happened. And for the nephew to have gone into the hospital setting for treatment, it sounds like that was something that was clearly necessary. I would encourage, if it has not been recommended already by the hospital staff, that the person continue with outpatient treatment even once the inpatient treatment has terminated. So I would encourage outpatient substance abuse treatment to continue efforts in recovery and a life that is free from substance dependence or abuse, if that is an issue.
Okay. I hope that answers your question. I'm not sure if you're logged in currently. If you are and you would like to expound upon that comment, please feel free to either type it in the comment section or you can speak yourself. Also, we have another I think it's more of a comment here, but it says, I have a close relative who has been seeing a therapist for 4 years. He suffers from anxiety and depression. He did not leave his house for over 10 years and is in his late 30s. He seems to not be making much progress with his current therapist, who's a social worker, but not sure what else he can take on because he does not work and only has Medicaid. So I think that's asking for a response to that.
Okay. So with Medicaid, if that is the only insurance that he has, if that's the primary insurance, then there are several options. I know sometimes people feel like as if they're limited when they have Medicaid and they're looking for mental health services. But the truth is that there are many people who accept Medicaid. So I would say, depending on the county that the person resides in who's currently receiving the treatment, I would say the first thing would be to check in with your community mental health. So Wayne County has a community mental health system, as well as Macomb and Oakland. Every county has a community mental health department. And I would say check in there, go through their intake or their access department, and you can seek another therapist who accepts Medicaid through your local or county community mental health agency. Another option is to go on Psychology Today, and that is a website where there is a list of therapists, and you can filter who you're looking for or what criteria you have as the patient. So if you're looking for a person who, let's say, lives in or works out of the city of Grand Rapids, for an example, or you're looking for a therapist who is female or male, or you're looking for a therapist who specializes in a certain mental health condition or diagnosis, including if you're looking for a person who accepts Medicaid, you can filter your search criteria. And so if Medicaid is something that the person is or has as a requirement for the therapist that they see, then I would say Psychology Today is also a great resource, and just filter the search based on insurance carrier.
Thank you very much. And once again, whoever posed that comment, feel free to, was it you? Okay, sure. If you have anything else you'd like to add to it, you can add. If you want some more information, and please share it as well. You can unmute yourself if you'd like. Okay. Anything else, please type it in. Give you a few minutes to think about if you have a question you'd like to share. Anyone on any subject at all? And we're going to continue with talking about bullying is what we're going to transfer into, but that doesn't mean don't talk about anything else. So as we talk about bullying, as you think along the way, you can come in and change the conversation as quickly as you want, okay? But the reason why we're talking about this, once again, is the month to be aware. But, you know, every month is a month to keep your eye open for such a serious thing as bullying. And you think it may not affect me, but no, it affects all of us, because bullying can transfer into a lot of other components that affect us all, including, I think, Dr. Jackson, you and I talked about even school shootings and things that are really, really extreme can often stem from things like bullying, signs that are often missed. And I want to hint on that as much as we can. Maybe I should start off with a question, Dr. Jackson. And first thing I think about are, as a parent myself, what are signs that your child may be experiencing bullying? Because I know my daughter experienced it all the way from first grade. And I had to notice the signs because she didn't just come right out and tell me. So for as young as, 5 or 6, all the way through high school, can you talk about some of the signs of bullying, Dr. Jackson?
So some of the things that come up in children or even people who are dealing with bullying or even harassment in the school setting would be any extreme behavior. Okay, so extreme would be if you notice that your child is normally very talkative and interactive, and now they have gone to the extreme of being very quiet, withdrawn, they're sad, or they used to be very outgoing and playful and happy, then I would focus and pay attention to extreme shifts. And then the opposite is also true. If your child is normally very quiet and calm, but yet now they're demonstrating behavior that seems to be really anxious, right? So they're asking for double of certain things, right? So they want double the snacks in their lunches, right? They want double the money that you would normally give them. When they start to double up, right, on things, that may be a sign. If your child is normally out, quiet or calm, but yet they seem to be more anxious and talkative and nervous, and they're shifting and seeming more restless, and more irritated, very low frustration tolerance level. They seem to be bothered very easily. So again, any extreme behavior, there's not necessarily one simple thing to look for, but any extreme shift, and those shifts push the child in these extreme categories of temperament and behavior, I would say look for those types of signs, okay, in your children. And for those children that actually do speak up, my first remark or suggestion is to listen. Don't minimize, right? So I would say it's better to err on the side of caution. And sometimes parents, we may feel like, oh, we don't want to bother a teacher with this. We don't want to bother the principal. We don't want to come across as if we're making a fuss, and we don't want to be viewed as a troublemaker. It's really all worth it, even if that is the perception that other people may have of you, to protect your child. It's absolutely worth it. And so to be a concerned parent is not being a troublemaker. It is not being a bother. And I think that is so important with parents, because I speak to a lot of parents about this topic. And when there are concerns that come up in school, what I have heard so often is that, well, I don't want to say anything because I don't want them to think that I'm just another parent who's just complaining about something. And so that thought that we have about the potential negative opinion of someone else has oftentimes hindered parents from following their instinct and following what their gut is telling them to do, hindering them from doing what they really want to do or feel led to do because they fear the reaction of other people. So it becomes really important to understand that being a concerned parent is never a problem. The problem happens when we're not led by the concern that we have, or we're not listening to our children, and at least in investigating, at least asking some questions to clarify or get additional information from what our children have. Because honestly, if we're talking, depending on the age of the child that we're talking about, sometimes children they don't have the vocabulary yet. They're so young, they don't yet have the vocabulary to accurately describe or explain exactly what's going on. And so that's when it becomes our responsibility as parents to advocate for them and to question teachers and principals and other parents, even to make sure that our children are being protected and that they're safe in the school setting.
Very good. Wow. And my thoughts went all the way back, 15 years ago it's been, to think about some of the things that you've said, because you can be, I guess, a couple of types of parents. One, that you don't want to be too pushy or aggressive or assume, or the kind of parent that I was let me get to that school. I don't care if it is 6 p.m. and I'm finding out I want to get there right now and deal with the matter right this instant, which is still not necessarily a good thing, because that can also cause your child to not want to even tell you because they don't want you to explode, or, so you really have to think things through and calm yourself down and realize the best way to address a situation. And in my case, and you can talk about this, Dr. Jackson, where I had a soft-spoken, mild temperament child, And the signs were not necessarily there because she was already quiet anyway. And I found out this child was hitting my daughter and calling her names. What do you do? Who do you approach first? The school, I guess?
Well, I think the first thing to do is once it comes out and once you are given that type of information, I would say the first thing is the teacher, right? Whether it's the homeroom teacher, the primary teacher. If your child is in elementary school, it's probably just one teacher that they're really engaged with from day to day. If the child is, middle school and high school, there could be several teachers. So then in that case, you want to find out what class is the situation occurring in and go to that teacher. And the reason I say that is because you want to at least give the teacher the opportunity to explain to you what they know, maybe what they have done. And sometimes teachers put things in place, but they don't always let the child know what they have put in place. And the parent doesn't know. So it doesn't mean that they haven't reached out to the other parent yet. Right? Maybe that has happened, but maybe it hasn't happened. But because of the unknowns that are there, that would be the reason for the parent reaching out to the teacher to find out how much the teacher knows. And if the teacher is aware, then what have they put in place to make sure your child is protected? And also with that, I think it's also important to notify the administrator of the school, like the principal of the school, so that the principal is also aware. And it's not something that needs to be done in secrecy. It's nothing. That's what the CC button is for in the email, right? So we can, speak with the teacher, follow up, and CC the principal as well. We can verbally tell the teacher, okay, thank you so much for meeting with me about this. I will be sending an email to you and the principal just as a follow-up, right? So there's an open line of communication. So again, I think sometimes parents will feel like, well, if I CC the principal, then it seems like I'm going over their head. Well, in fact, what you're doing is you're making sure that everyone responsible for the safety of your child is fully aware of what's happening, and they are all a part of working as a team for the protection of your child. And no one is able to say, I did not know, because that is what comes up a lot, is that a person will say they didn't know. And that's the very first statement, because if we didn't tell them, we really didn't give them the opportunity to do anything about it. Right? So we want to give people the opportunity to show that they will take these concerns and these issues seriously. And we can best do that by, of course, communicating what is going on and making sure that we are keeping record of these things. Because over time, the truth is, as humans, we forget. We forget the details. I can't imagine how many parents and students, teachers are dealing with email and conversations with over the course of just one given day, right? And the same thing is true for the principal of the school. Their days, I'm sure, are quite busy. So that would be another benefit for following up with an email. So then things are documented, and we're not just trying to remember all of the details, because our memory is flawed. No matter how much we think we can remember, our memory is flawed and we don't remember everything. So the best way to capture these conversations and these moments is really through email and through letter format, making sure that there's a documentation so that we're keeping a record of what has transpired and also the efforts that's been put in to the situation. Because what happens is, over time, when things start to, if things continue to escalate, and we're questioned about whether or not we told the teacher or talked to the teacher or told the principal, now we have documentation to show, yes, I absolutely did. I did my part as a parent. I tried to communicate these things, and I tried to resolve these things on my end, right? And we have documentation to show our efforts, which is always important.
What you're saying is so great. And I was thinking, I'm such an advocate for the children, and it isn't to downplay or discredit the responsibilities that teachers and administrators have, because they work so hard. But I still want to say that it's so important to stand behind and with your child, because if they are expressing something or showing signs that something is going on, it is so important to me that a parent or guardian takes it seriously and acts upon it, and act quickly. Because if they're telling you or showing signs, more than likely it isn't just occurring. It has been occurring for some length of time, I would presume. And I just believe it's so important. I know after you send email, I'll tell you, I always blurt out all my personal business, but when emails are going out, still be mindful, because you don't know the extreme of the bullying your child can be experiencing. I kept my daughter home and included in the email that my daughter will remain home until there's a response to the email, because bullying often goes on every day if the child is seeing that other child every day, and you don't know how much it will escalate. I've seen even adults feel anger toward a parent for not responding to things that have happened to them in the past. So if you have the opportunity, I think, to address it now, please do. Don't take it lightly. What I ended up doing, I emailed the teacher. I didn't get a response. And this is not in Novi School, so you can't track where it is. I emailed the principal. There was a vague response of, I will get to it. And then when there was a meeting, I actually went to that department's police station and asked for a police officer to accompany me to the school while we addressed the matter. So to me, it's no such thing as going overboard for your child. It's more rewarding to do that for everyone involved than to just push it to the side or take it lightly. Things are serious. And I mean, children have a lot to deal with. And if they don't have the support from their parents or family, then who supports them? So I think that's very important to stress how much attention you need to give to that. And let's talk about, you talked about this one I didn't even think about. Bullying, it doesn't have to be from a peer. It can sometimes come from, I'll let you take it from there, Dr. Jackson. Teachers.
Bullying, just like with anything else that we do in our, well, everything else that we have conversations about with our children. So we want our children to know that bad things don't just happen to us from strangers, right? So sometimes it happens within the home setting. Sometimes it can happen within the family setting, extended family members. Sometimes it can happen from teachers at school or administrators at school. So I know that when my child was very young, not at the school that she's attending now, but at a different school, she was in a situation where there was bullying by a teacher. And I had to work my way up to the superintendent's office to have the matter properly addressed. And those things are very serious. So sometimes what happens is you'll notice that your child is talking to you at home about the way in which the teacher treats them differently than the other children. Now, I know that we may say, but children say that all the time. Children always make a difference between themselves and someone else. But again, if we're looking at if we're going to move forward and err on the side of caution, then again, we're always looking into it. So the first step is to always investigate and always look into the matter and try to address the person directly, right? So it's not, addressing things directly does not mean that you have to be rude or inconsiderate. You can still be polite and very professional, but you can also be very direct and stern at the same time, right? And very clear and precise about what you're talking about. And sometimes what happens is there is shaming that happens. So maybe in the classroom setting, there's a teacher that calls out the wrong or the mistakes, right? So we know as humans, and especially children, mistakes are always made. There's always a mistake that's being made. And if your child is feeling as if they are being essentially thrown under the bus in front of everyone else in class, right? They're being shamed about making a mistake, or there being an error of some type, or their grades are lower. Grades are not necessarily something that should be talked about in front of the entire class, right? My classmates shouldn't know about the fact that I failed a grade or a test unless I told, the teacher as a student. So when things like that are happening, and whether the teacher, some things may not be intentional, but we know that even if there is a lack of intention and something isn't being done maliciously, but yet it still is hurtful, then it's something that needs to be addressed, right? So the same thing is true in any other situation. So we're not saying that things are always done intentionally, but even if it's done unintentionally, but yet it's still creating distress for a person, that's still a problem, right? So there's still something that's happening that needs to be corrected. And it is legit. It's something that legitimately is of a concern and it should be corrected. So sometimes when your child is coming home and you're getting those types of reports about, my teacher is always doing this to me and it doesn't happen to the other children, and I noticed that my teacher seems to do this with me and not and they start giving examples. Well, John did this and nothing happened to John, but then I did this and then I had to stand up in front of the whole class and be scolded by my teacher in front of everyone, right? Which would be really inappropriate, I think, in a classroom setting. So if things like that are happening on a regular basis, then that's probably something that should be looked into and questioned, right? Because the idea of going to school is not just learning the material, it is going into a safe environment. Our children are going to these environments 5 days a week for at least 7 hours a day. That is a lot of time. That is a lot of time for our children to be around and in a situation that makes them feel unsafe, that makes them feel unprotected and vulnerable. So who else would they have if we as parents do not advocate for them and stand up for their rights as children? So there are times when we have to have those conversations and help our children know that when we talk about bullying, we're talking about bullying at the hands of anyone. Right? At the hands of anyone. The same way that we will speak to our children about abuse or being touched inappropriately, we have to include, this is not just about strangers. This is about if uncle does this or auntie does this or granddad or grandma does this, because we have to help our children see that even though they have reverence for people that have certain roles in their lives, that these other people are still humans too. And so we want them to be aware that if you notice anything that makes you feel uncomfortable, or if you experience things that make you feel uncomfortable, please bring that back to mommy or back to daddy, and we will look into that. We are here for you, right? Encouraging the children that they have the freedom to come to us, because sometimes when bad things happen by people who our children esteem, it creates confusion. And it can also create silence on their end because they're not really sure what to do with it. They don't want to get this person that they care about and that they reverence in trouble, right? So their reaction is oftentimes very different when it happens from a person that they esteem and have respect for versus a stranger, right? A person where there's no relationship, no connection. So be careful or be mindful rather, to have those type of very specific open conversations with your children about what to look out for, and what they can bring back to you. Because the more that you talk about it with them, then the more they become comfortable with bringing it back to you, because it reminds them, the moment that it happens, it reminds them, oh, mom or dad said, if this were to ever happen, that I should talk to them about it, right? So if people start to say, well, don't tell, or this is our secret, or make sure you don't say anything, I'll get in trouble, they already know you because you've already prepped them and warned them, right? So it's not something that they have to stay silent about, because you've already given permission for them to use their voice.
Is there something a parent can do or suggest to administrators at school if someone who's being bullied continues to see the bullier every day, even after it's been reported? Because, well, I guess several things can happen. The bully can stop bullying, but I'm sure often they don't. They just become more aggressive, even if they change up the style of their bullying. What can you recommend a parent do? Do they work with the administrator on how to address it, or what suggestions can you offer a parent when the person is still around the person who's bullying?
Well, you absolutely speak to administrators. You want to get them involved. You want to go as far as necessary until someone listens. I know that growing up, I remember it always being said, you speak until someone listens. You tell until someone listens. You continue to tell. So I would say use that same basic idea to parents. You speak until someone listens. You continue to go up the ladder until someone listens, even if it means that it leads you to the Board of Education, right? Even if it means that it leads you to media outlets. Because if there is no one that's willing to listen or take heed to the concerns that you are bringing up for the safety of your child, then you continue to speak. So one of the things about bullying is that bullying is something that is, for an example, dehumanizing, intimidating to another person, hostile. I think it's important for us to know what it means to be bullied, right? Because bullying is not just, I had an argument with a friend and the friend made me upset. Right. And it's like a one-time occurrence. You know, it's still within the limits of what we would consider normal kid behavior. It's not that you had a difference of opinion, right? And you all don't like the other person's opinion. It's something that happens that is dehumanizing. It's intimidating. It is hostile. It creates a hostile learning environment for another person. It's humiliating. It's threatening, and it happens over and over again. It can invoke physical harm, verbal harm. We've heard about cyberbullying now. Of course, that's a thing now in the internet and social media age. It can be directed at one person, or it can be directed at multiple people or a group of people, right? So it can include acts of racism. It can include acts of body shaming, right? Or academic performance shaming, athletic performance shaming. So whenever you have something where it is inhibiting another child to be active in the academic setting or in an activity within the school realm, it is also considered an aspect of bullying. So sometimes the bullying can get to the point where, as you mentioned earlier, Gail, that you pulled your child from school. Sometimes a child will resist going to school because the bullying is so severe. At other times, the child, they may attend school, but they no longer want to participate in any activities. So they're a part of certain athletic teams, but the bullying is so severe, it makes them feel so unsafe or so threatened by another person, they no longer want to engage. That's pretty severe, right? When a person is starting to, even sometimes bullying can lead to self-harm. They begin to harm themselves physically because the bullying the bullying has become that distressful. I've had reports of children even having suicidal ideation because no one has listened to them and the person or the student has felt that their voice is not being heard. And that's extremely discouraging for me to hear that as a psychologist and even as a parent, as I talk to students. It is extremely discouraging to hear that any child, for any reason, would ever be in a situation where they feel as if when they open their mouth to speak, that they are shamed or they are made to feel as if their concern is not valid. Which
that I had issue with is when the bully and the person being bullied are told after their talk, both of you apologize to each other. And it's like, go along and be friends. I wouldn't let my daughter do that either. I'm not as tough as I appear. But, I mean, people apologize. I've heard that more than on one occasion where I think it's not to blame one or the other. So both apologize. Talk about that. Am I wrong for opposing that?
No, you're absolutely not wrong, because what that does is it puts both the children in the same category when they are clearly not in the same category. One child is clearly the aggressor and the other child is clearly the one that's receiving the aggression. And so in that case, no, it's absolutely insufficient for both children to apologize when one child is clearly the one who has been the aggressor, the one who's initiating the physical violence or the physical aggression, right? And then the other child is made to also apologize. And as you mentioned, go along and be friends. Okay, are you all going to agree to get along with each other? And they kind of make it into a we thing or a you all thing. You all will get along, when clearly it's only one child who's doing the aggressive, the aggression, the aggressive behavior. And so it's not okay for that to not be addressed, right?
The chat reminds me of the movie Dear Evan Hansen's. So yeah.
Even for teachers, I think for teachers, sometimes they become uncomfortable with having to make the phone call to the parent, right? Mm-hmm. They don't want to make that phone call and tell a parent that their child is creating problems in the classroom or is being the aggressor. And I would say that is when it becomes so important for the administrators to create policy and procedure, because that policy and procedure, in fact, supports the teacher, mm-hmm. right? So now it doesn't come across as if the teacher is being subjective and arbitrary. Now it is that the teacher is being objective, right? Because now they have a policy to fall back on, and they're just simply now following the policy and following the procedure, right? So this was
that's absolutely right, Dr. Jackson. Yes,
right. So even though I think some schools are hesitant, I'm working on something like that now. That the schools may be hesitant to implement a policy like that. But when in fact they're supporting not only the students in doing so, but they're supporting the staff in doing so.
Mm-hmm. Oh, exactly. The same student, when the parent was made aware that their child was a bully, the parent was almost a bully as well, and responded it was not good. And I think you probably answered that, but talk about that a little bit, because often bullies, I shouldn't say often, sometimes bullies pick up traits from what's at home. This mom was just as careless about the whole situation as the child was. Then what? Can you even speak to that on a psychology professional level, or is that another category?
Well, we know that oftentimes, and I'm glad that you clarified, not every time, but oftentimes we can expect that a lot of the behavior that we see in children is learned behavior. Right? Now, the opposite is also true, that sometimes our children just do the exact opposite of how we're raising them, right? And parents wonder, I don't know where this child came from. I don't know.
The father's side or the mother's side. They pass it off, huh?
Right, exactly. So yes, it is true that there are other factors that contribute to how a child shows up at school that does not necessarily match how they're truly being raised. So in situations, however, when it does seem to match how they're being raised, right, and how the parents come across and how the parents speak about things, because I have experienced that as well, where you see the child's behavior and then you speak to the parent, and then the parent begins to advocate for the child's misbehavior. And they say, well, we teach our children this, and we teach our children to do certain things. It's very clear, right?
What did your child do? They'll respond that way too.
Yes.
From a friend.
Yeah. So it becomes very clear that it's maybe even a tougher situation to deal with. But then I say this, Gail, that's again, go back to the policy and procedure. See, in the conversation of National Bullying Prevention Month, one of the first things that we see in the research is that, and in these policies and procedures, and we look at what are the aspirations of this bullying prevention. One of the very first things that we see is that bullying prevention first is a responsibility of the adults involved. That's first, because our children learn from us. And it's just like with anything else. If the school is able to take a position and they are able to communicate to the community at large that this type of behavior is unacceptable, we see that the research shows that there is a huge reduction in the bullying type of behavior. It becomes a deterrent. So when the school is able to say, and through not only policy and procedures, but also assemblies, right? So student assemblies. And then when you talk about parents having the same horrible behavior or mentality and attitude, you have parent assemblies. And the school is then making it aware. Again, it's not, now it's no longer subjective, right? So now parents are not able to say, oh, well, why are they talking to us about this? Why are they having a meeting with us? Well, now it's an entire school assembly. So all parents are required to attend this assembly, and then maybe either separately, children have an assembly in school. I remember being raised, Gail, on what was the assembly we would always have growing up? It was about drugs and fire safety. Was it the DARE program? The DARE, I think it was DARE. DARE, DARE.
Our generations are a little different. I don't think they had that when I was young, but I have heard of it.
There was a DARE program, and it was for students and it was for parents. And it was, it was something that was always had year after year, right? So this type of education is not just to be held once a year. I mean, one time and that's it. It's held every year. Why? Because students are always changing in the school. Families are always changing in their enrollment in different school districts. And even if it's the same district, sometimes schools are just set up differently, right? So when there's new families that come on board, new children that come on board, new teachers that come on board, this is something that is done this is an annual thing. This is several times a year even, right? You do it so that children, parents, and teachers all know their specific role, their specific expectations that the school has for their position, for their roles, right? So students have the expectation. These are your expectations as students. This is the role that you play in standing up against bullying. This is how you report. This is our protocol. Right? So schools need to have protocols in place. These are the designated staff people that you can go to. And then I'll take it a step further. I was recently doing some research and looking up even for private schools, right? Because private schools are a little different. They can sometimes get away without having these things in place because it's not mandated. So then it becomes important for the administrators to have the integrity and have the heart to create these programs in the school setting, right?
Another thing, Dr. Jackson, I'm sorry. I know another thing I wanted to make sure we get in here. I wanted you to address, Dr. Jackson. We've talked a lot about the child who's being bullied, but the bullier, I have empathy for them as well, because I mean, starting as young as 5, all the way up through, there's a reason behind why they bully. And I think that comes from a hurtful place. And I think that needs to be addressed as well. So if you are a parent listening and you think, oh, my child is not being bullied, still consider, are they the bullier? And that can sometimes even be more painful to think about or even recognize as a parent. So can you address that?
Absolutely. If we're talking about a person who is doing the bullying, then again, doing things as a group is so much better than trying to deal with things from an isolated position. So if a parent is a parent of a child who is engaging in the bullying behavior, then I would say find support for your child and find support for yourself as well. Right. And so the question becomes, well, what type of support? Where am I getting this support from? So there are support groups. There are anger management groups. there is still therapy that's involved. So the person who is receiving the bullying may require therapy to deal with the aspect of being attacked and targeted in school. But it's also true that there's something not right? There's something happening, whether we're talking about depression of the child who is actively doing the bullying, whether we're talking about there being a disconnect in the family home where there may not be healthy attachment between the child and the parent that's causing the child to act out. There's some need that's not being met of that child who's engaging in the bullying behavior. There still is need for there to be a support system for that child. And again, that can best be received by getting the school involved, right? Getting the school involved and talking to the school. And how can the school support that child? Is there counseling that can happen within the school setting? Is there some type of plan, some type of treatment plan, educational treatment plan that can be designed and set up to better support that child who is the one actually bullying? Now, this type of support does not negate the consequences, the meaningful consequences that still need to be a part of the problem solving. But it doesn't mean that there only needs to be the negative consequences. There can always be positive supports and reinforcement for positive behavior, right? The positive behavior that you want to be displayed, right, by the child who is initiating the problematic behavior. So looking at some positive reinforcement for positive behavior when it is displayed, so that can be a deterrent for the negative behavior, right? So it's like, that kind of lends itself to, again, looking for counseling services or social worker support services in the school setting for that child as well. And if that's not available, then I would recommend, the outpatient type of behavioral health treatment that may be available. And these things are available, whether it's through a private practice, a clinician or therapist that works in private practice, or there's a plethora of nonprofit or community-based supports, again, going through your local or county level community mental health setting can also show or lead a parent to the support that they need. Havenwick Hospital is a setting as well. They have so many different support groups that are available. Havenwick Hospital. So the word is hospital, and sometimes people, they fear that phrase. They think it's an inpatient setting, but it's not. It's outpatient as well. And even during the pandemic, they offer a lot of support groups as well. And so I would say look into Havenwick as well. And I mentioned them just because they have so many, and they're open to all county residents.
I also have a question on Facebook that says, any thoughts on restorative justice in school versus a punitive response?
Yes, which is what I just talked about, right? So that positive reinforcement. So some of that positive reinforcement is what I was talking about earlier, and not just looking at the negative consequences for the bad behavior. So some of the restorative would be like a strength-based approach. So finding out and looking at the strengths of the child that is displaying the negative behavior in order to encourage more of that positive behavior. And that is something that can be done through the school setting, and advocating for the school to be a part of that restorative type justice, right? So maybe that means the child is a part of community-based service projects, right? Maybe the child who's causing the problem, maybe they take the lead on some of the more, community-based and volunteer assignments, right? So getting them involved versus pushing them away, because I would believe that what that person who may be bullying is probably dealing with is already feelings of rejection. So they don't need more of that. They probably need to be pulled in more right? And be made to feel more of the positive aspects of the school and the community. So again, the parents getting involved in that and the school getting involved in that. What I mentioned earlier is that we can do so much more as a group and as a team working together versus, or more so than working isolated, right? Working in isolation. And so again, that is where a really strong anti-bully policy comes into place, right? Because even that policy looks at the restorative justice factor as well as the consequences that come with the behavior. So even though, just like as a parent at home, right? One of the best compliments I was ever given by my children was when they told me separately, which was a huge compliment. So
you froze.
That they came together and said this and kind of came and kind of huddled up and said it. But they each said it differently at different ages. But they said to me that even though I have to give consequences to them, and I may give consequences to them, they always feel loved.
Oh yeah.
That's was so important. Huge. That was huge. I mean, that's what you want as a parent. One of the goals in parenting as well as in school settings is, yes, we give those consequences, but we give them in such a way that our children or the students do not walk away feeling defeated or feeling as if we have put them down as a person or as a human, but they walk away knowing that, yes, the behavior was absolutely wrong and unacceptable, but that they are still loved.
That handles a lot. I think it's so important.
That's the goal, is that we, in our approach to correcting bad or inappropriate behavior, is that we still esteem the child in the process.
For sure. There's another comment here on Zoom. Once again, if you have a comment or question, please feel free to type it in Facebook or on the Zoom platform, or you can open up your mic and ask the question yourself. I do see that it says, what are the best things that children who are bystanders can do?
They can use their words. They can use their words, and they can stand up for the person who is being bullied. So they can stand up, and if they see, for an example, a child who's been pushed to the side or who's being marginalized or even ignored, and just using that for an example. So let's just say that a person is not necessarily having anything verbally said to them, but through the nonverbals of their peers, they feel as if they are being mistreated, right? So that can also happen in a school setting so very often, where children feel marginalized. And actually research shows that being marginalized can sometimes feel worse than even being treated negatively, right? Because being marginalized is that we don't even care enough about you to acknowledge you one way or the other. Yeah. Right. And that can feel so hurtful. So when bullying happens or maltreatment happens to another peer, I think the best thing that their fellow peers can do is to use their words and to speak up and use their behavior to support the other child. So when you hear another child being teased, or when you hear an inappropriate racial remark that is being made in the classroom setting, that you speak up and you can say something as simple as, that's not right. You shouldn't say that. That's not okay. That's not cool. Nobody's laughing, right? Mm-hmm. So you can say the other students can say things like that to put a stop to it versus feeling the need to comment and feed into it, right? Or laugh at a joke that they know is wrong, right? Because sometimes people feel like they have to do that just to fit in. But I think now the goal is becoming to make to make it so uncomfortable for the wrong behavior to happen, right?
I
So
think also that's a good way of teaching care and love and compassion to your child, because some parents may say, oh, my child isn't being bullied, or my child isn't the bullier. But if you want to practice instilling compassion in your child, you can take that child who isn't involved in any of that and tell them, be on the lookout for how are your classmates being treated? How are your friends being treated? And how do you handle that? And that can encourage them to step in and voice their thoughts on things that are wrong. It gives them power and strength, and puts them in the right direction of care and love, I believe.
absolutely. Asking your children, children, they come home and they talk about these things, right? The observers or the bystanders, some of them come home and talk about it with their parents. And I think as parents, if we take those moments and start to ask our children, so, oh, is that what happened to your friend? So what do you think about that? Right? So often our children are wanting us to give them our reaction and our feedback, which there is a time and place for that. But if you have older children, before you jump in and give your opinion about something, it is fantastic if we can take a moment and put a pause in our reaction and response and ask our children, what did you think about that? So, did you say anything? What did you say? Oh, you didn't say anything? What do you think you may have said? What do you think you may have done now in hindsight that if it happens again, you could do in the future? What do you think you may be able to do in the future that may help your friend next time if this other person does this again? What do you think you can do? Right? And so that gives them ownership. So it's not that you're telling them next time you better do this, right? Which how often, sometimes that can backfire on us and our child doesn't want to listen to us. But if we simply ask the question, they can then start to take ownership, right? And it becomes their decision to do something, right, different or better the next time. Did you think that was nice? How do you think that person felt when that happened, right? It gives them now this ability, we talk about emotional intelligence, right? Getting our children to think about how something made another person feel is so important. Helping our children to place themselves in the position of another person, right? How would you feel if you were judged based on, your eye color? How would you feel if you were left out because somebody said you were too big or you were too slow, right? How would you feel if you were the last one to be picked? I understand you were the first one to be picked. I understand that you haven't experienced that, but how would you feel? How do you think you would feel if you were in that person's position? What would you want your friends to do if someone did this to you or someone did that to you, right? Again, helping our children to be empathetic.
Yes, we as parents, keeping our eyes and ears open and not being afraid to address serious topics like bullying is one step, I believe, toward making progress, because there are definitely more people who are on the good side of things than the actual bulliers. So we can unify and make progressive efforts to make things better. The hour is almost done. I want you to give some closing remarks on the topic. It can be maybe to the bully, to the bullier, to the parents of wanting to know where do they fit in this topic. Talk on any of that briefly as we close, Dr. Jackson.
Well, you know what? I think I would say that if we all understood the power of our voice, I know that sometimes people feel as if, oh, I don't want to get involved in that. I'm going to leave that alone. I'm not going to say anything about that at all. Sometimes we remove ourselves from situations because we feel like to do so, like to get involved, is creating problems. When in fact, we're actually being a part of positive change. And being a part of positive change is always always the right thing to do. It is always the right thing to do. So I would encourage the parents that are listening, and even those parents who may have pulled their children in to listen to tonight's segment, I would say be a part of positive change. Don't remain silent. I remember at one point I had challenged a group of people, and I actually put a post out on a platform that I use, and I said, turning your head away from dirty dishes does not cause the dirty dishes to go away.
That's true.
They just cause the only outcome from turning your head from dirty dishes is to create more of a mess in the sink, right? They just stay, right? We have to first make a decision to actually attend to the dishes. We have to first acknowledge that our sink is full of dirty dishes, and then we have to make a decision to actually do something about it. So I would encourage each person listening to make a decision to do something about it, even if it just simply means encouraging your child to speak up, right? Even if they're not the aggressor and they're not the one being bullied, we all still have a role to play in helping to resolve the issue of bullying, because we are all saddened and we are all disappointed and we are all grieved when we see and we hear about the school shootings that happens across the country as a result of a person being bullied and no one did anything but remain silent and ignore the problem.
Thank you, Dr. Jackson. Very relevant discussion, I believe. I appreciate your professionalism and insight, and hopefully encouragement for those of you who are listening. I hope you have some takeaways from that to share or to utilize yourself. I hope that was very useful to you. We will have another mental health check-in November 1st. I was trying to look real quickly at the calendar. It's November 1st, I believe. Is that right, Dr. Jackson? You're going to be joining us again. And once again, it's mental health check-in. So there's no topic. Well, I guess I shouldn't say that. I was going to say no topic off the board, but I guess there will be some. But if you have questions, you can email me in advance, ganderson@novilibrary.org. You can do that and pose questions on anything that you have concern with. And look, this is a free opportunity for some mental health services here, it seems. So take advantage of it. Anything that you're thinking about, it doesn't have to be about children. It can be about whatever you want it to be about that's within the realm of our expertise of our professionals. You can attend, you can register for the program. It will be at 7 p.m. once again, November 1st. We will have the same platform, Zoom and Facebook Live. So keep that in mind, share with a friend if you need any assistance, because now is really the time. So much is going on in all areas of our lives on a variety of topics. And we certainly want to provide all of the assistance that we can to make sure we all move forward in the right direction. That's all of our goals. Thank you so much, Dr. Jackson, for your time. Thank you for joining us on Facebook and Zoom, and have a good rest of the evening. It's starting to get it was cold today, wasn't it? We have no more daylight. I used to look out and say we have some daylight, but we have no more daylight. So there we are.
Thank you so much, Gail, for having me.
For sure. Have a good evening, everyone, and good night.